Hi, everyone, and welcome to another Q&A on Crushing Doubt. It is Monday at 6 p.m. Eastern, 3 p.m. Pacific. This is our usual time, and it is good to be back. So we have some questions already in, and Matt Anderson has returned for some questions. Matt, welcome back. So I'm going to get started with that, but I do want to just put in a plug for something before I do, Matt. I'll get to you in a second. And that is that I am looking for people who are willing to tell their stories of healing in a variety of ways. It certainly doesn't have to be through work with me. I want to hear stories of people getting better, whether it's through reading books or working with different practitioners or figuring out their own method in some way. I want to hear those stories. And the more that we share these with other people, the more hope we give to people. So if you are willing to share your story, please contact me at dan@crushingdoubt.org. And I will respond to you and we'll get you scheduled. And I look forward to hearing from a bunch of people. I'm sure that there are people out there who have a great story to tell. Okay, Matt, we're going to start with your question. Two-part question, you say. We're going to do the first part first. Many practitioners include spirit and or the soul to their mind-body process. Where do you see the spirit-soul fitting in your practice? So we'll get to the second part of the question in a second. Let's just hold this one up on the screen for now. So that is a fantastic question, and I think each practitioner has different takes on different aspects of things, but it really is true that there's a lot of spirit soul in all of this. And I guess the place where I see it working in my system is primarily in the power column. In the power column, when we develop that core narrative, we're really talking about who are you at your core and what do you need? And to me, that's very in line with spirit and soul. And what I have found is that as people get better, they tend to gravitate towards an alignment with the self. And it's a really moving part of the process that I didn't know about until I saw it for myself. I started reading Sarno and I started getting better. But what I found is that I also started getting better within myself. And that to me is where the nourishment of the soul is coming in. So that's where I see it fitting in my practice. Let's come to the next part of the question. Matt says, also, do you believe that one's emotional DNA is also influenced by your past lives or ancestors? Oh, cool. All right, we'll get into this. More of a deep spiritual question, but would be interested to hear your viewpoint. This is funny, Matt, but I'd be interested to hear my viewpoint also because I hadn't really thought about it that way. But we're about to find out. I don't really know. I was speaking with somebody recently, and they are a Jungian therapist. And the Jungian therapists do believe in past lives, or at least in the ancestors and what is passed down. Here's what I do feel like I know. I think there is generational trauma that gets passed down. And we could see that through any number of ways. A kind of more spiritually minded person might think that comes from past lives or ancestors or emotional DNA. Even scientists who believe in the strength of DNA could believe that lots of things can get passed down in the DNA. And I believe all of that is possible. I'm open to all kinds of things. I really don't know what I feel about past lives yet. We'll have to keep exploring. Maybe in a past life I believed in that, but I don't know. We'll see. But I do think that trauma gets passed down from generations. And when I was talking to this one person, he was very insightful about it. And I'm always learning from each of you about things. And one thing I feel like I learned from him is that whether this is passed down through the DNA or some kind of spiritual passing down, I do believe that things get passed down. And a lot of times people are carrying the weight of their ancestry or the weight of their family traditions. And so I don't know if that answers your question fully, but I would say that that's my take on it to this point. But I would love to hear your feedback on that. And let's keep having a discussion. So we have a question from Karen Isaacs, also a return commenter. Good to see you, Karen. In fact, Karen did a testimonial about her healing, which was not with me, but she did achieve her healing. And she has said that in her journey, I was helpful kind of getting her over the hump towards the end. So welcome back, Karen. She says, my question, if you believe in this 150% and doing the emotion work, why pains? I've had the old acid reflux pains for several weeks. I'm feeling my feelings. Do I have to accept it's part of my thing? Absolutely not. Now let's get into why, Karen. First of all, I always love to compliment the people on the questions because they are great questions, but it's especially because they highlight things that are so helpful for so many people. So here's the thing. I think it's very important in getting back to the way we want to live, or maybe getting to live better than we ever did, to always challenge the symptoms. I am a firm believer that it is the human condition to have these symptoms from time to time. We're all going to have mind-body symptoms. But I think it's very important that we call them into question and we push ourselves to be able to live the life that we want to live. I also believe that these symptoms are all, in general, mind-body issues. Of course, there are those very high-level medical issues that are not mind-body. Those are the ones that are why we get checked out by doctors, and we need to keep doing that. I get a checkup every year because we need to keep up with the physicality of things. Even the physicality that could be affected by mind-body experience, we need to know that a medical doctor is taking a look at that. But once we're past that, I think you can not only safely assume that it is a mind-body issue, but there are things that you can do about it. And my thought, Karen, is this. What I'm hearing you say is you're feeling your feelings. Do I have to just accept as part of my thing because I'm already feeling the feelings? But here's the thing. This is why I developed the other columns, because I had the same experience that you have, which is that I was feeling all of my feelings. In fact, I had years and years of therapy experience. I felt that I was pretty insightful. And looking back, I actually was. I still had things to learn. That's often the case. But what I was finding is it seemed that the symptoms didn't always relate to emotion. And that is where I started thinking about, well, what's going on in my thinking? And it was in my thinking that the doubt is there. What I'm hearing in your question, and I certainly don't mean anything bad by this, I mean this is good news because it's a way out, is that you believe in this 150% in most areas. But doubt has a way of creeping in any little crack that there is. And I'm hearing a little crack here, which is essentially this question. This is what I do in the doubt column, is get these questions articulated. You're saying, is this particular symptom one that I just have to live with? Is there no way to crack this code? That's a doubt right there. So I want you to kind of lean into that doubt and push back against it. And what I can tell you is that both the doubt and the power column are other ways to solve the problem. If emotions are not getting it done, there's 4 different types of doubts that I've talked about. That's having full certainty or not. That is confusion, questions, and fear. That all covers doubt. That's a lot of room to run with. If you can pinpoint what the doubt is and you can get those questions answered, then you'll have something. That's where I would look first. We can go to the power column next if that doesn't work, Karen, but I would say think about the question that I articulated that you're asking. Is this one different? Let's think about why that would be different. And come back to me on this, Karen. Tell me if that answered your question, if you need more on it, but I would love to continue that discussion. Okay, so a follow-up from Matt Anderson. He says, yeah, for me, I truly believe in the past life aspect. Obviously, at this point, it may be too difficult to have the evidence to support it, but if we truly are merely an energy force, it makes sense. One thing that I have really loved about this TMS process is it actually has made me kind of more spiritual, more open to different things, and not to get all spiritual on things, but I do think the world didn't actually make that much sense to me until I started listening to my body. When I started listening to my body, and I would say actually I didn't even make sense to me fully. I knew a lot about myself, but that's not the same thing as making sense to yourself. When I started listening to my body, the story that I knew from my childhood of what had happened to me and the impact all felt very resonant in my body. And this led me to really believe that there seems to be a greater structure to things. I don't know what that is, and I won't speculate. This is not a religious exercise, but I understand that possible viewpoint. I do think we are an energy force of some kind. So I don't know what happens, but I totally support that viewpoint, and I think it's a totally plausible one to me. I don't know where we go after or where we were before. So there's all kinds of questions about it. I love this topic. Okay, we have another question. It is from Kim Herwick, another return questioner and someone I've worked with before, and she's asking, is it possible to eliminate IBS? Okay, now I will say this. IBS is a mind-body symptom, but there are different kinds of mind-body symptoms that I've found. Some symptoms relate to being kind of, I call it attentional TMS, which is that tension myositis syndrome that Sarno talks about, but it's attention mind-body issues where you're having the symptoms because you can't stop thinking about it. Now, IBS is not one of those, but IBS is a different type of mind-body symptom that I talk about. And to me, it's what I call a discharge symptom. What it means is it's a symptom that comes on. It tends to be more severe, and you can get rid of it. So IBS, any kind of lower GI stuff is true, but upper GI stuff too. Throwing up is another discharge thing. Really, spasms in a way are a discharge thing. It's an energy burst of some kind, and it takes away your focus from the emotional experience, whatever it is, and discharges it in a way. What I like to do is, if I can be in touch with that discharge idea, I really like to get focused on my anger, because anger is another way to discharge, and you don't need to discharge interpersonally. In fact, I don't recommend that. That's not for the best. But what you can do is discharge it within yourself by having the feeling and being aware of it and being kind of really balled up about the anger just for a little bit. And it gives you a way to discharge it. So with the question of, can you eliminate IBS? Discharge mind-body issues are harder to eliminate fully because they come on suddenly. They're hard to predict. But the good news is, because of the rules of thumb we have, we know that they're emotionally based. So IBS is pretty much always emotionally based. That means you do not need to look in doubt so much. Now, I realize Kim's question, is it possible to eliminate IBS, shows a doubt, and it could perpetuate that happening more often. But each time it's emotional. So is it possible to eliminate IBS? I would say you probably can't eliminate it from your life altogether, but you can severely limit how much it affects you and even how often it happens. I have had IBS symptoms and gotten rid of them. I just mean in the moment. It's a moment-to-moment thing. So if my stomach's bothering me and I start thinking, wait a minute, did something just happen? I follow the same rules of logic that I apply at other times. I think about the timing. Okay, this symptom came on now. What was happening? And I get a lot of insight from these things. So there is a way to turn any symptom into information. And a lot of times you can get the symptom to abate if you hit on the right idea. There are going to be times where you don't expect yourself to be perfect in this way, and let yourself be a human being. But you can actually, I need to add one thing to that too. You can work on the emotion at the outset. But the other thing is, you can also eliminate IBS symptoms that do relate to doubt, because I've heard this a lot. Sometimes people will have an IBS kind of attack and then they think, well, I got to stay at home the whole day. Well, that's not true. If you are in a place where you've resolved your doubt enough, you can know, no, that attack is done. It has been discharged. I should be fine. But that's especially true if you get in touch with the emotion. So I would say, if you want to eliminate IBS as best you can, be aware of the emotional charge and whatever was going on specifically before it happened. Look out for those things and fight doubt. It's actually just like any other symptom. It has its difference because of the discharge element. But other than that, it is like any other symptom. And in that way, it largely can be eliminated. But, mind-body symptoms can't be eliminated entirely. We talk about a cure sometimes, but I've started to gravitate more towards mastering. Because we don't cure them and get rid of them entirely, but we can master them. We can become really good with the rules and knowing what to do. So let me know if that answers your question, Kim. Okay, Man Anderson says, for us to develop traits, personalities, traumas, etc. from past lives, no idea how many past lives I may have had, but I believe I've had one. Interesting. Perhaps doppelgangers support this theory, and then LOL. Well, maybe. I don't know. Matt, do you have doppelgangers? You let me know. I have been, people have told me that I look a little bit like Tom Green at times, so maybe he's a doppelganger of mine. He's a complete nutball, so I've got that side of me. I've heard Nicolas Cage as well. So those are some of my famous doppelgangers, but I'm sure there are others out there. Okay, Karen Isaacs is giving me a follow-up on her question. She says, I love your answer. Yes, you're spot on. It gives me hope. Good. I know this acid reflux, heaviness, coughing, exhaustion lately is definitely TMS. Thank you. Thank you. Absolutely. When I say I do have to accept this is my thing, I meant do you have to accept symptoms will pop up, go round and round? I want to go a full year with no symptoms, or when symptoms pop up, they go by. Okay, so I will say this. I was just talking to somebody about this. I've added it to my action steps list that one of the action steps you need to keep in your mindset is that we have to have the will to beat TMS. It's going to try to get us despondent. It's going to try to get us to lose hope at times. And it takes a kind of competitive spirit against that part of the mind-body experience. So stay competitive, stay in the game. You want to keep working at it, but it does get better and better. And I think we can extend the boundaries out. So Karen, can you go a full year with no symptoms? Absolutely. I have gone more than a year without getting a cold. And that is because I've challenged when I start to feel a kind of cold tickle in my throat or something like that. I challenged, no, this is a mind-body thing. If I let it develop more, it could become something that is, a full-blown cold, but I can challenge it. Sometimes I can do it successfully. Sometimes I can't, but I've extended the boundaries. And the more we do that, the more we believe in how far we can go. I'm a big sports fan. It's a lot like athletes. When they've achieved a certain thing, it's a lot easier to achieve again. So keep working at it. One thing to say, Karen, is that I do know someone who came to me with acid reflux, and she had it for 9 years, and she was on a lot of kind of higher level medications, prescription medications for it. And we hit on a specific emotional thing that she didn't know about, and it vanished. Now, I'm sometimes a little hesitant to share these stories because I think for the people who are having trouble getting better, it sounds so magical, and it can be they can be despairing when they hear that. But there's many different ways that this goes. Sometimes you hit on a key emotional thing. Sometimes it's about resolving doubt. Sometimes it's about power. Sometimes it takes a long time. Sometimes it goes away suddenly. Sometimes it takes a long time and then goes away suddenly. I would say just keep working at it. You have a relationship to your symptoms, and you can extend the boundaries of how far you can go with it. Now, I do want to say, for anybody out there who is a newcomer, and this is particularly true sometimes, that people are shy to pop up and ask a question, I just wanted to say, if you haven't already, click subscribe, ring the bell for notifications, hit like if you like what you're hearing, and put your comments below. I always get back to people personally, and I'm having a great time doing that. And I think it's adding a lot because people are seeing each other's comments, and we're all learning from each other. So that's great. Okay, we have a comment from Linda Elarde. And Linda, I have a question from you from last week, which I will load if there is time. But I'll get your question from this week first. When pain fluctuates from day to day, from mild to severe with no warning, what is the best way to respond to that? The roller coaster effect is very frustrating, and it's hard to plan anything. That's a great question, Linda. And here's my thinking on it. When it comes to this work, the reason I've developed the columns is it's very organizing for me, and I find that people often tell me it's organizing for them as well. So I would want to look in the different columns. When you're having this fluctuation day to day, the very first place I would look is in the emotions column. I would look for the timing with the onset of the symptom or the uptick in the symptom, and see if you can find out which of those themes relates. But you're also talking about something that I'm hearing would play into doubt, because if pain is fluctuating a lot, then it it becomes more than just the emotional issue. It becomes an issue of doubt. Now you're saying, I can't figure this out. I don't know what's what. And that's what's so frustrating. So I would say, first of all, don't give up hope. Mind-body issues always make sense. I just want to highlight that again. They always make sense. Just because we don't know what is happening yet doesn't mean they don't make sense. It just means we need to keep using the framework. And it could be a framework from somebody else. I highly recommend mine, of course, but different frameworks work for different people. I would encourage you, if you hit an impasse, though, reach out to me. Just send me an email, or we can start texting a little bit. And again, my email is dan@crushingdoubt.org, and I can kind of help you troubleshoot. And there's different ways to do this. I also, as many of you know, and have even gotten the PDFs, I do have these PDFs for purchase for relatively low fee, and they have lots of information. That includes a troubleshooting PDF, and it has, I think, like, I keep developing. They get longer and longer, but I have like 19 different reasons people aren't getting better. So there are ideas and ways to understand it. So the main thing, Alinda, is don't give up on understanding it. We can help you make sense of this. Reach out to me if you have any trouble with it. I also did want to say, if people want to come directly on here, we haven't often had people who feel that they want to do that, but Matt Anderson did come on at one point, which I appreciated, especially because it was part of his power column actions for himself. But if you want to come on by video or even just audio, you can go to www.callcrushingdoubt.org, and you can come on anytime, and I would look forward to that. Okay, we have a question from Tony Smith, another return commenter. It's really great to see you all out here. We've got a very active group, and I love that. Tony says, tips on overcoming a huge setback. I recently broke my shoulder. I'm sorry, Tony. Very sorry to hear that. She says some tendons may be involved, but that is unknown yet. It feels overwhelming to have this kind of injury while also healing from TMS. That's absolutely understandable, Tony. I'm going to give you my framework for dealing with this, and I do think it will be very helpful to you, but I want your feedback, because ultimately it's not about what I think. You live in the mind you live in. So here's what I would say. I want you to separate out the breaking of the shoulder from whatever other damage was in there with tendons, ligaments, anything else. Because here's the thing. It all heals within 12 weeks at most. All of it. There's nothing in there that's not going to heal. So I would put yourself on the time frame of the bone. They may have said 6 to 8 weeks. They may have said 8 to 12 weeks. Put yourself on that time frame and trust, if you can, that in my experience, which is pretty extensive by now, these things all heal within that same amount of time. You won't need to do anything else, nothing else at all. So anything after that is going to be TMS, going to be a mind-body syndrome, PPD, whatever we call it. So I would say, Tony, try to, if you can, take my reassurance that you're not going to have an ongoing issue, but what you are describing is a very wise thing to note. You had an injury and a traumatic, difficult one, but you also are suffering from a trigger. And we're going to be having a video coming out on triggers this week, I believe, actually. It's a bit hard for me to remember sometimes because it's, going through a lot of things. But triggers are physical events that can plausibly convince you that you've got an ongoing pain that will just hurt and hurt and hurt. So, Tony, you have an injury and a trigger at once, and I totally get why that would be overwhelming. But if you separate it out, you don't have to do anything about the trigger all that much while you're healing from the break. And then after the break, you can deal with the trigger. And if you need my help, just reach out. I did also want to say again, if you do have a testimonial of your healing experience or even a struggle that you've had, I would love to have you come on the show. Just let me know. I've given out my email many times, but I'm going to do it again. It's dan@crushingdoubt.org, and you can contact me if you wanted to come on the show and talk about your experience. Okay, we've got a question from Sylvia Sierra, another return commenter. So she says, "Hi, Dan. I feel like I've hit a bit of a wall lately. You're not alone. I'm definitely hearing that a lot from lots of people, and I've done it myself at various times. Even though it's not as bad as it was when I started this path last June, I'm still having some kind of migraine head pain almost 24/7. I'm more productive and active, but it's still frustrating that the pain is always there. None of the methods of talking to the pain, etc., seem to diminish it. Okay, so Sylvia, there's going to be different ways that we may need to go about things, and so I say this a lot. We need flexible strategies. So when you find something that works, that's great, and that's in your arsenal. But if you hit a wall, essentially what we're finding then is that you need another strategy. You need another way to develop things. This is how I developed my columns. They were my strategies that found ways around walls. And then I found strategies within each of those columns. So what I'm hearing here, and I could be wrong about this, but let's compare notes, Sylvia, and I'll help you find your way through this. I'm thinking that you were working with emotional stuff and you were working with doubt stuff. And what ends up happening is the part of the mind-body process that wants to resist that and wants to be able to hold on is trying to get you to doubt again. And so usually what happens is it compromises. It says, okay, well, you got me. I'll lessen, but I'm not going to go away fully. And so I think that what's happening is you've got the mind-body system on the run, and it's now trying to get you to sign a peace treaty with it, to say, okay, let me be here at a lesser level. And I want to encourage you, never sign a peace treaty with a mind-body issue. There's no reason to. You can reduce it to zero. And you're not alone. People have hit walls before, but this is actually part of my area of expertise. So please reach out if you need to, and I hope that's helpful to hear. We have a question from Magic Bob, New Jersey. I believe we've interacted on comments, but I have not seen you yet on the chat group, so thanks for joining us. He says, I cannot empty my bladder completely since November 2014 due to me manifesting my stress to my pelvic muscles. Sarno's book rid me of back pain in 2009 just by reading it, and similarly of post-op hernia pain. Been using Sarno's method for 6 weeks, no change. What would be helpful is reading testimonials or being told of others with the same symptoms that were helped. Great point. So, Bob, let's get you better, and then we'll have you be a testimonial. But for now, if there's anybody out there who's listening and has a similar story to Bob, please comment below, and we'll get that information to him. He's got one more part of his question, but I cannot find any by Googling. Searching the TMS Wiki, I just wanted to say, the TMS Wiki is a website that you can go to that was started by followers of Sarno, and it's like a Wikipedia page for TMS, and it has different practitioners and different discussion groups and things like that. So it's a very helpful resource. He even posted a question there. He says, the closest thing is pelvic pain, but no bladder emptying issue. Okay. So, Bob, first of all, I want to empathize with you. It's hard to have a symptom that you're not hearing about out there. I wanted to ask a question, and then I want you to get back to me, and then I'll do some follow-up. I wanted to hear, have you been to a medical doctor about that particular problem? When I say this, I'm not saying that because I'm like, uh-oh, that sounds like a medical issue. That's not why I'm asking. It's more that it makes me feel more certain in what I can recommend, which is better. It's better if I can feel more certain in what I can recommend, because we know I'm trying to get rid of doubt, and I can do that more strongly. So get back to me on that first, and then I'll weigh in either way about this bladder emptying problem, which I do think at least has a mind-body component at the very least. So my personal suspicion is that it's fully that, but we'll get to that. So let me know, Bob, and then I'll get back to you. Linda has a follow-up on her question. Dan, I think you are right that doubt is behind the extreme fluctuations. When it is severe, I do have uncontrollable thoughts pop in that there are physical issues, even though I know it's TMS or mind-body issue. So yes, Linda, let's remember always, everybody, don't stop thinking about doubt, because it'll slip in through every crack that there is. The reason I developed this whole idea is that I had thousands and thousands of doubts, and I couldn't believe how many there were. It was about every little thing, and it was driving me crazy. But the interesting thing is, once I recognized that general pattern, each little doubt became a lot less powerful. And so when you're finding yourself having a setback, whether it's through like a trigger that Sylvia experienced, I'm sorry, it was Tony that experienced that, but or a wall that Sylvia hit, or extreme fluctuations, or just a symptom that's not getting better, like Karen was talking about. These are all examples of doubt, all of them. And it's very helpful to see them all illustrated. So I appreciate you all sharing that. So Linda, just recognize there's going to be times where doubt creeps in. Doubt creeped in for me this weekend. I had a symptom, and it kind of scared me a little bit. It was a muscle that was just like the muscle that I had serious problems with for 8 years. And I had to work at it. I had to be like, no. It's really trying to scare you. You know what? I never figured out what the emotional issue was this weekend. Never figured it out. But emotional issues come and go very quickly. And so then I was like, all that's left is doubt. And just by knowing it was doubt and keeping that front and center, it never developed into anything that bad. And now it's gone. Okay, Tony is responding to how I responded to her. She says, it's a very helpful approach. I'm glad to hear it. The trauma, trigger, and fear are all in play. I am fearful of a full tear surgery. Separating out helps. Yes. In a sling for 6 weeks total for the bone to heal. MRI soon. Okay. So Tony, this is what I would say would be your plan if I could lay it out for you. But of course, you're in charge here. But I would say you don't need to think about this at all for 6 weeks. But you can know that at 6 weeks, we're going to hit the ground running on a number of things. First of all, we're going to be very skeptical of what doctors say about the MRI. They can say all kinds of things, but they have a very bad track record of this. As you guys probably know from listening to me, I have a healthy level of respect for doctors about many different things. But when they've been wrong about this over and over and over, we need to be skeptical of it. And if there are tears, a lot of times they'll say there are tears that are not significant. One of the examples that I use is if you're wearing a t-shirt and it rips let's say it rips here, it's still a functional t-shirt. It works just fine. Your body has a lot of parts like this. So we think of the appendix as the only vestigial organ there is, but there's a lot of vestigial organs throughout your body. And a lot of these tendons they're doubling up on things. So you may not even need that. You could have a full tear and not need anything. One thing I will say to you, Tony, is you are not going to need surgery for this. You are not. I have lots and lots of experience with people healing from these things within that time frame, just fine. I even have experience with people having things like labral tears, and then they go lift weights the next day because I tell them that's incidental to this pain. We've seen studies with this. So separate it out, 6 weeks of healing. Don't worry about anything else. And then we deal with the trigger and the data you're going to get from the doctors, which, by the way, is going to be another trigger. Give yourself space to deal with the emotional trauma of it all, though. It's a very upsetting event, but you're going to be fine. This is just something to work through. So I hope that's helpful. Sylvia says, you're right, Dan. I've done a lot of the emotional stuff and keep journaling on a daily basis. Journal speak. That makes sense to me about the peace treaty. I'll keep trying things and won't give in. Excellent. We have to have a very strong willpower against mind-body issues. And Sylvia, I'm glad that helps. Bob, I want to jump back to you because I hadn't heard back from you on the doctor thing. So I'm going to take this assuming that you have seen a doctor, just so you can get the information that you need. The mind-body process can do pretty much anything. It can do anything that the body is capable of doing. So the thing I needed to learn about to make sense of it is, what is the body doing? And the thing that helped me, and maybe it'll help you, is to read the book Molecules of Emotion by Candace Pert. Sarno mentions this in The Divided Mind, but when I read Molecules of Emotion, I did have this inkling. I was like, I don't know if Sarno fully read this book, because it has so many great things in it that really describe what's going on in the body. Just to make it short, he has a theory about, the pelvic stress was diagnosed by a urologist in 2015. Okay, so I went on the right assumption. That's good. What we can do then, Bob, is totally assume this is a mind-body issue. He had an MRI in January, all clear. Beautiful. So The doctor stuff is just to get doubt out of the way. You know, the funny thing is you can go to a doctor and they can give you doubt. But if that's the case, you can come to me or somebody else who understands these things and we can clear that out. But doctors will rule out the doubts that we can't rule out. So it's good that you have that. This is a mind-body issue. And it's not surprising. When you think about it, anxiety affects urination all the time. I've been shocked by this. Oh, you saw Dr. Guads. He's great. Dr. Guads is in New Jersey. He's one of my favorite MDs who does this work. He's a TMS medical doctor trained directly by Sarno. He confirmed that Bob has TMS. That's wonderful. And for people on the East Coast, Dr. Guads is great. I don't know if he does virtual consults, but he's truly fantastic. So if you need somebody to do that, that work to diagnose into a specific TMS condition that a doctor does, he's highly recommended. So Bob, I would say with respect to this bladder thing, what I was saying is that anxiety affects urination a lot. If you have a lot of anxiety, you'll urinate more, but you also can not be able to urinate. This is funny because this is a joke that we had like as teenagers, but we noticed that there was this thing. It would often happen at sporting events. You'd be standing in a urinal. This is a very male-oriented thing. But we would get something called pee fright. And it was that you knew you were supposed to go and you didn't want to hold people up. And as such, you just couldn't do it. So urination is very tied to anxiety. So Bob, the place that I would look is at anxiety as a mind-body issue. I've said this many times, but depression and anxiety have a mind-body component to them. And I think that's one of the tips that I want to point you in the direction of. I want you to start thinking of anxiety and get in touch with what parts of the emotional column may be at play leading to that anxiety. And look, doubts also kind of got you right where it wants you on this. It's got a symptom that's not giving up. Well, you need to not give up too. That seems to be the theme of the day. Don't give up. You got to push back against it. And as you push that belief system, you can start to get little gains. Let's say, the bladder starts to empty a little bit more, or you can empty it fully some of the time. If that happens at all, you're onto it. And so let's start with that. And then you can certainly contact me if you're still having trouble breaking through. I want to remind everybody out there, if you haven't already, click subscribe, ring the bell for notifications, hit like if you like what you're hearing. It does help me know what's useful to you and what isn't. Although I will always try to be useful as much as possible. And put your comments below. I will answer you directly. Okay, Sylvia was asking what book I mentioned, but Hannah Mink answered Molecules of Motion. Thank you. I know this is not allowed, but Bob could try pelvic floor physical therapy. Okay, now Hannah Mink said that, and I would say this. I don't want anybody out there thinking that something's not allowed. What I think about is you have your own individual mind, and you're going to need what you need. And the only thing I would say is that if you do try physical therapy, you try something else, just make sure it isn't contributing to doubt. One of the best things you can do is there are certain physical therapists that know about the mind-body issues, and we want to try to link you up with some of those. In fact, I'm slowly but surely collecting a list of these kinds of things, and we are working on getting our website up and running, and that should be soon. And when we have that website up and running, we will have those resources on those pages. Along with that will be the chance to sign up for my seminars. We want to have the website up and running before I get started on those seminars, but they're ready to go, and we're excited to get started with that. So if these things help, that's fine. Just make sure they don't contribute to doubt. And I would have a talk with your physical therapist or acupuncturist or chiropractor or whoever you're meeting with. If it's helping, it's helping. That's great. But if you get stuck at a plateau, it might be because of doubt. Now, we did have some preloaded questions, and let's bring up the first of that, Courtney. I think it was actually from you, Linda. So let's get that up. How do you feel about expressive writing that is random and rambling? Is it still effective? Great question. My answer to a lot of questions starts with depends, but I don't finish there because that's a very unsatisfying and unhelpful answer. But it is an important part of answers because Expressive writing that is random and rambling is going to work for some people. I would say for people who are not particularly aware of their emotions, it can be extremely effective. So with journal speak, for example, that Nicole Sachs advocates for and got such relief for in herself, it can help you get in touch with things. But what you want to do is pay attention to you. If you find you're writing and writing and writing and it's not getting you anywhere, well, that tells you something too. Or alternatively, and this can be equally important, if you're writing and you start to have pain, or you start to hurt, or you start to feel worse, or your anxiety goes up, you don't have to do it that way. That's a time where I would advocate going through one of the other columns, because it could be that the emotions column is just overloading you at that point, and it's not actually even where the issue is. So I encourage you to try some other things. Ultimately, it depends, but I would say random and rambling things sometimes give you the freedom to let something out. It's kind of like free association in therapy. You can discover some things that you didn't think. But I wouldn't do it over and over and over for, a hugely long amount of time if you're not seeing results. Then there's other ways to go. Let's bring up another question that we had waiting in the wings. Okay, from Ann B. TMS celebrities seem to have different takes on autoimmune issues. I don't know if I qualify as a celebrity or not, but I know what Ann means by this. There are people, like Howard Schubiner or Sarno himself, Dave Clark, a lot of these guys who have been around, a lot of Nicole Sachs, who a lot of people know. And they say different things, but they have different takes on autoimmune issues, especially. That's a very, very common thing to see some disagreement about. Some say adamantly that they are not TMS or mind-body syndromes or symptoms and curable, and others say the opposite, that they are, that autoimmune issues are mind-body issues. It's hard to crush doubt about rheumatoid arthritis with such an unclear position from the TMS community about autoimmune issues. I'd love to hear your thoughts on this. Okay, now this is a complicated one, and we're running towards the end of this, so I may bring this back up again next week if there's time, or I encourage other people to bring it up as a follow-up. But I would say this: a lot of autoimmune issues. Well, let's start with this. Autoimmune issues can be caused by many different things. There can be genetic components. There can be environmental components that lead to it, and autoimmune includes cancer, by the way. So there's lots of different things that can lead to it. It can. Some people think that it can relate to diet, and these are very complicated issues. The other thing that can happen is that it can be about gene regulation, and what people talk about is that genes can be upregulated, meaning activated, or they can be downregulated, meaning they won't get activated. I will tell you my personal belief, but take it with a grain of salt, because this is not one of those things that I can say is fact. What I can say is it fits with my experience, and that experience runs deep, because I believe that my own father died of an autoimmune issue, cancer, that was related to unprocessed emotional trauma. I do think that can happen. The ACE studies suggest that that can happen across the board. Studies continue to show that. So I would say this: I think that mind-body issues, especially unprocessed trauma that you're not aware of, can lead to a lot of autoimmune issues. Once there is an autoimmune issue, a lot of times we're going to need particular medical help with it. I don't tend to advocate for trying to treat cancer with just a mind-body response. Once you're into a situation where there's anything that's life-threatening, I want a medical doctor involved and advising on those things. We can use mind-body positions to treat it, though, as well. I do think that this kind of mind-body treatment can help. I think it can help with the symptoms. It probably can even help with how severe it gets, and it may even be life-saving. I wish I could give you a clearer answer on that, but I think the clearest answer I can give you is that all of the answers together, to me, suggest that autoimmune issues can begin with mind-body process. They can be altered with mind-body process, and they can be affected positively with this kind of treatment. But ultimately, yes, we want to make sure that medicine is involved as well. Okay, we got one more question. We actually have an observation from Magic Bob again. Hanamek, my urologist, referred me to his best PT in 2015 after 9 sessions, absolutely no change, nor to the other things he had me try. Okay, so everybody's going to find different things. And so I would say None of you need to beat your head against a brick wall in anything. Not in anything. We need flexible strategies. That even includes with me. And so Hannah is asking if it's pelvic floor. So you guys discuss that and we'll get back. I'll get back to you. But you don't need to beat your head against a brick wall in anything. That even includes in the work with me. So what I would say is if you feel you are beating your head against a brick wall with me, check in with me again. I've had this happen a number of times, and I want to say this to a lot of people out there, especially those who have worked with me, got some relief while they were working with me, and then because they were short-term consults, didn't reconnect with me when the symptoms didn't get better or if they had a flare-up. Remember how insidious doubt is. You need to be willing to check back in, and you need to have the will to fight through it and keep at it. But please, 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 if you're out there and you've given this a try and you feel like you're beating your head against a brick wall or you're not getting somewhere, usually there's an answer, kind of like some of the answers that I gave today, where doubt has come and crept back in. If we can describe what it's about and what's going on, we can get you relief. Please don't lose hope. There's lots of help out there. Okay, guys, we're going to wrap up for today. We did have some questions that I did not get to in the preloaded questions. I'm going to kick those over into next week. Or if you had a question that you know you asked me and you want it answered before next time, just send me an email and let me know. It was really a pleasure. We had a very active group again, and I appreciate all of your questions and sharing your thoughts. We got a great crowd out here, and I'm happy to be of help in any way that I can. So if you haven't already, click subscribe, ring the bell for notifications, hit like if you like what you're hearing, and put your comments below. And a reminder that we are looking for testimonials or experiences of getting better. You don't have to be all better to come on. It can be something where you got partially better. In fact, Magic Bob, you might want to be one of them because you have had healing experience, and we can have more of a conversation about it. There's no pressure to do this, but I would love to hear from you all. And the more stories we have out there, the better. Thanks, everybody, and I look forward to doing this again next week. Same time. It's 6 p.m. Eastern, 3 p.m. Pacific, and I look forward to seeing you then. And Hannah gets a thank you in at the end. Thank you. Thank you, guys. It was great talking with you.